All right. Hello, everyone. Good afternoon to everyone joining us from here in Maryland. It is an honor to welcome all of you here today to the 2025 Early Hearing Detection and Intervention Stakeholders Conference. This work is deeply personal to many people, not just for professionals, but really as humans who care about ensuring that every child has the opportunity to thrive from the very start. I'd like to introduce myself. My name is Thomas Horges. I am chair of the Maryland Early Intervention Advisory Council. For myself, being part of the Maryland EHDI efforts is not just a professional duty, but is a commitment to our families, to equity, and to early intervention that has a transformative impact on their lives. It's really a vocation, and it is our highest call for children to create a better tomorrow for all of us. I was recently having a conversation with a very wise individual, and she reminded me of an important East African tribe known as the Maasai. And that Maasai tribe is very famous for being very children-centered. For example, when they greet each other, they don't say, "How are you doing?" Instead, in their tribal language, the first thing they say is Kasirian and Jerry, which translates to roughly, "How are the children?" Okay, that allows them to use their children as a North Star to remind each other, and it serves to remind us when we do this work to always think about and ask ourselves, how are the children? So in your day-to-day work, if you're not sure if your work is really contributing to the field and to supporting the efforts of elevating our children, allow me to offer some thoughts and some guiding questions that you can ask yourself. The first should always be, is my work children-centered? The second, is my work culturally relevant? Meaning, are we valuing the culture of our children that we bring, not just their culture in their deaf identity, but those other intersectional identities that they might have? Okay. Are we considering that cultural relevance? And third, is my work trauma-informed? Are we approaching things from a holistic, trauma-informed approach when interacting with our children and our families, particularly when those parents find out that their child does not fit the status quo? We know that they could possibly be going through a grieving process, and it is our duty to make sure that through our conversations and our questions from the heart that we help to reduce that trauma. The state of Maryland, as we know, has historically been a leader in early intervention screenings, and we continue to push forward with systems that are responsive, inclusive, and family-centered. EHDI itself is not just a one-time screening. No, it really is a continuing, evolving continuum of care that supports children and families through not only early identification, but timely interventions and ongoing language development. The state of Maryland is also one of the most diverse states in the country. Not just geographically diverse, where I am here in Edgewater, Maryland, I actually had a very nice drive. I'm from a rural area of Dayton in Clarksville. That's where we actually hosted last year's statewide conference. That took place in Clarksville. For those of you who remember, it's rather rural. Okay, so if we're talking about the 24 counties throughout Maryland, there's a lot of diversity, not just geographically, but ethnically, religiously, economically, so forth and so on. So we need to consider and value the importance of that diversity. So early intervention cannot be just one size fits all. Although we may be tempted to use a more standardized approach for the purposes of efficiency, that ultimately does harm to the process. So constantly to remind ourselves who care about early intervention that it needs to be customized to each child and family. In addition to that, with intervention is not just for the child and the family, but it's also intervention for us as professionals, how we engage with the system to support those children. So it is for, of, but also with. We are in this ever evolving process together. So, why does this conference matter? This conference is a critical touch point for all of us. It brings together voices from the healthcare sphere, the education sphere, family advocacy, and community leadership to ensure that we stay aligned, informed, and ultimately, and most importantly, inspired. It allows us to lift that fog of our everyday work and to take an opportunity to see each other, to reflect, to examine, and to assess. We need to be adaptive. Course continues to evolve in terms of the technology related to the screenings and to the practices we engage with with our families. All of this is critical. We are here today to renew our shared commitment to giving each child in Maryland the best possible start, regardless of their hearing status. Now, I would like to acknowledge and give much gratitude to the American Society of Deaf Children, ASDC, for hosting this year's conference. Their leadership and collaboration has what's helped keep Maryland's EHDI work strong and grounded in those family-centered values. To all of you joining us today, to our attendees, thank you for showing up and being here, okay, every day, each and every day for our children. Your presence reflects that dedication it takes to keep us all moving forward together. And those of you listening to the presentations, let us take the time to remind each other of our vocation and ask, how are the children? Because ultimately their future relies on us. So thank you for being here today. And I'm going to turn things over to Sherry Dowling to continue the rest of the conference. Please enjoy, everyone.
Hello, everyone. My name is Yasmin Price, and I am the new program manager for the Maryland Early Hearing Detection and Intervention Program. Today, I will be providing you all with a few program updates. I kindly ask that you use the chat for any questions you may have, and I will answer them at the end of the presentation. I would like to begin by acknowledging the mission, vision, strategies, and shared goals of the Maryland Department of Health, Prevention, and Health Promotion Administration. In short, the mission is to promote and improve the health and well-being of all Marylanders. The department envisions a future in which all Marylanders have equitable opportunities to live, thrive, and be healthy. In this presentation, I intend to level set and provide a reminder of the program's background and goals, provide updates on where we currently are by looking at key achievements and milestones, then providing a summary of where we are going and how we will be informing the future work of the Maryland EHDI program. So, background about the program. The Maryland EHDI program is established under Health General Article 13601 and 13605. The statute establishes a program for the universal hearing screening of newborns and early identification and follow-up of newborns and infants who have or who are at risk for developing a permanent hearing status that affects speech language skills. The statute establishes the Early Hearing Detection and Intervention Advisory Council and requires hospitals to submit results of the hearing screening to the Department of Health. The program is also regulated under COMAR. The hearing screening process. At birth, babies born in a hospital should receive a hearing screening before discharge. After birth or discharge from the hospitals, babies are referred to a community audiologist, If the baby doesn't receive a hearing screening in the hospital, if the baby doesn't pass the hearing screening in the hospital in one or both ears, or if the baby is not born in a hospital. To follow up to the screening process, the Maryland EHDI program awards grant funds to an external organization to conduct follow-up services and provide family support. Families are contacted at least 3 times, which include an initial letter or phone call, and supported through the process of scheduling an initial or follow-up screening. If the primary care provider is known, they are also contacted. The Maryland Early Hearing Detection and Intervention Program aims to ensure that the hearing status of newborns and infants is identified early, and if appropriate, referrals to early intervention services occurs at the earliest age possible. The goals of the program are that all babies should receive a hearing screening by 1 month of age. All babies with a hearing status should be diagnosed by 3 months of age, and all babies with a hearing status should be enrolled in early intervention by 6 months of age. So where we currently are. The program is currently conducting birth facility site visits, providing screening equipment to local health departments, updating resources through a health literacy lens, strengthening data analytic capabilities, and each of these achievements and current practices will be explained over the next few slides. As a coordinated newborn screening effort with the Office of Children and Youth with Specific Healthcare Needs Blood Spot Program, the Maryland EHDI program is conducting birth facility site visits to strengthen relationships with facilities and providers, to strengthen hearing screening protocols, to identify areas for further training and support, such as reporting data to the EHDI information system, and also to really reinforce that infants born with a hearing difference who are identified and given appropriate intervention before 6 months of age demonstrate significantly better language and reading comprehension than children identified after 6 months of age. To provide accessibility to rural families and infants who are born outside of a hospital, the Maryland EHDI program provides screening equipment to 6 local health departments. Maryland EHDI coordinates training and technical support to local health departments to integrate hearing screening into their existing clinical services. We are really excited about this achievement, and we would like to expand this opportunity to more local health departments. We continue updating resources with a health literacy lens, ensuring that resources are accessible and usable for all stakeholders. The graphics on the screen are documents that we are currently assessing and updating. The updated documents will be available on the Maryland EHDI website when complete. The image on the left side of the screen, the infant hearing roadmap, provides a walkthrough of getting through that 136 process that I previously explained. The graphic or document on the right-hand side of the screen provides tips for scheduling a follow-up screening. Looking at the current state of the program by the data. In 2023, 98.3% of babies were screened by 1 month. 38.9%, or 298 babies, were diagnosed by 3 months of age. And 67 babies were referred, and 48 babies were enrolled in early intervention services by 6 months. We are still in the process of analyzing data from 2024. However, we can see that the 1 month screen rate is consistent with the 2023 data at 98.3% of babies screened by 1 month of age. So we are doing really well at the 1 month screening mark. 47.9% of babies were diagnosed by 3 months of age, which increased from the 2023 data, which I just mentioned in 2023. That was about 38.9% of babies diagnosed by 3 months. So we've increased that 3 month screening rate. And 82 babies were referred, and 45 babies were enrolled in early intervention services by 6 months of age. So, where are we going? The future of the Maryland EHDI program will be informed through increased family engagement, continued advisory council support, data informed strategies, and with an enhanced infrastructure. So, looking at how we will be informing our future through increased family engagement. The Family Engagement and Systems Assessment Tool, also known as FESTAT, was created by Family Voices to assess family engagement in policies, practices, and other systems level initiatives. The program will facilitate the FESAT with the EHDI Advisory Council to better understand how we can increase family engagement and to better support families and increase the 6-month early intervention benchmark. The program will continue to work with our family engagement liaisons to provide seamless support to families whose children are referred for a diagnostic screening and are identified as deaf or hard of hearing. Based on previous program experience, we have combined the follow-up and family support services into a single grant award to ensure a smooth transition of support from screening and diagnosis into navigating resources and supports if a baby is identified as deaf or hard of hearing. The program will also be informing our future with the EHDI Advisory Council. Focus areas for the EHDI Advisory Council for the remainder of 2025 include, but are not limited to these things. But again, as I said, offering insight through the FESAT assessment. We will be doing that with the EHDI Advisory Council at our next council meeting. We will also be looking at identifying resources to support the 136 benchmarks, and the council will be supporting us in identifying geographical areas where babies are at risk of missing the 136 benchmarks. To better inform strategies to maintain and reach those 136 benchmarks, the program's epidemiologist has updated the EHDI data schematic to focus on babies who missed initial screening and were eligible, and babies who were referred but did not follow up for a diagnostic exam by various variables such as WIC status, jurisdiction of residence, and payment type. These analytical updates will allow us to better identify opportunities to better connect with families in the hopes of increasing our follow-up screening rates and our enrollment in early intervention. The program will be informed by a needs assessment to gain better understanding of the current infrastructure, readiness and capacity building, reaching underserved populations and communities, by understanding the needs of families served and identifying mechanisms to increase access to language and supports. Together, increased family engagement, continued advisory council support, data-informed strategies, and an enhanced infrastructure will support the program in continuing to reach and improve those 136 benchmarks. I've provided a short list here of resources that are available on the Maryland EHDI website. That first link is actually the link to the website. The second bullet there is the phone number to the Maryland EHDI resource line. And the last bullet is the link to the request for family support Google form. Although this information is all available on the Maryland EHDI website, it also will be dropped into the chat today. I've also included my contact information here on the presentation. So I can be contacted by email at yasmin.price1@maryland.gov. And I've also provided the email contact information to the program's audiologist and also our EHDI information systems database guru, Erin. We are so lucky and happy to have her, and many of you may know her. The Maryland EHDI program acknowledges the families and children whom we serve, the Maryland Department of Health, the Maryland EHDI program staff, past and present, Maryland EHDI system stakeholders, the Maryland EHDI Advisory Council, HRSA, and CDC. We continue to closely monitor developments at the federal level and are aware that the CDC EHDI staff have been affected. At this time, the Maryland EHDI program has not experienced a direct impact from the CDC EHDI staff's reduction in force, and our work here at Maryland EHDI continues as planned. Any questions? I can't see the chat, so if there are any in there, if someone, Sherry or Lauren, if you were able to read out any questions that may have been received.
Yasmin, I don't see any questions.
I have a question.
Yes.
So, hello, my name is Kayla. I just graduated Mount West. I live in Huntington, and our DHHR does not have the resources for the deaf. After I complete this, will I be able to take this to our local DHHR and show them that, I want to maybe work for the DHHR as an interpreter for the deaf people?
If you can, Kayla, provide your question in the email, I will follow up with you by email because it seems like the answer might be a little bit more nuanced. And I do want to just mention that I am new to the program, but I would love to support you and what you intend to do.
Because my goal is to work with children that are deaf in school.
Yes. So I can follow up with you on what that may look like or the best resources to provide you.
And
So I'm sorry, I
Yasmin,
don't have an answer
here.
for you at this second. Sorry. Yes, Sherry.
Hi, I'm Beth Vendemia. I'm an educational audiologist in Calvert County. Had a question about trying once babies are failing repeatedly and they're trying to get that confirmation ABR. Do we have a streamlined method to do that? Because many of our babies are finding that to be the stopping point. It's very difficult for them to get in and have that ABR done at some of our medical centers.
So the program does have a list of audiologists. So we do have a database of audiologists that we would be able to, our follow-up coordinators would be able to find someone in your area or find the best way to support getting that diagnostic exam scheduled. So if you can send me an email, we can definitely follow up with the list of providers that may be in your area.
Yasmin, I don't see any other questions in the chat. We still have about 15 minutes. Someone asked, payment for those without insurance, private or state?
I have a question, if I may.
I'm sorry. There were there were multiple. There was the question about the insurance providers, and I'm actually going to tap Lauren Whiteman, who is the director for our office, to help answer that question. And then I think someone had another question, or it might have been the same question.
Yeah, actually, this is Michelle Morales. I have a question. Perfect. Perfect. Okay, so just before we get into the insurance question, are we ready for me? Mm-hmm.
Yes.
Mm-hmm. Okay. All right, wonderful. Just double checking. Okay. So my question is, everybody's aware that Eddie disseminates numbers in terms of screenings that are done at hospitals that 1, 3, and 6 month, those particular screenings. And they do it based on the state. I'm wondering if that data has been disaggregated on the county level. Is that at all possible? So that's my question. Do we have that data broken down by county? Yasmin.
Yes. So I believe that the data is broken down regionally. It might be too small by county, but I can definitely follow up to confirm.
Okay, so it's regionally currently. Okay, yeah, I would appreciate that follow-up. Thank you so much.
Yep. And what was your name? Or can you drop your name and your question into the chat just so I can follow, I can get it after this?
Yeah,
And your
you have
contact
another
information.
question.
Yes.
How does Maryland EHDI data for 136 compare with the national data collection?
Yasmin, do you want me to jump in?
Yes, I was going to answer at the 1 month mark, but go ahead, Lauren.
Sure. And you would never know from listening to Yasmin's presentation that she has only been with us for 4 months now, I think. But just want to jump in since she's still getting acclimated. We are so for the 1 month data, we are above the national mark, which is around 95%, and then about on par for 3 months. And I think the current data for 2024 has us a little bit ahead. The most recent published data on the CDC for the 6 month mark is 40.7% who were enrolled in early intervention. So we are either on par or exceeding national benchmarks.
Thank you, Lauren.
You have another question from Karen Martin from Kent County, and she would like to know if the information on Maryland EHDI is broken down by county.
Yes, so we just answered that question. To my knowledge, it's broken down regionally. The county level data, some of it is too small to report on, or limited data to report on, but we can definitely follow up and confirm. Can you put your contact information in the chat and I can follow up with you after this presentation?
We have another question. Are there interpreting services? Are there interpreting services in most places doing follow-up testing?
I'm not sure if it was just on my end, but I couldn't hear the question because it was like breaking up a little bit. Sorry.
They would like to know if there's interpreting services available at the testing locations.
I will be completely honest. I am not sure, but I am going to say that that would need to be coordinated. And that's one of the good things about having our follow-up specialists that work with us here at the Maryland EHDI, that they can help support the family and making sure that there are interpreters with the family during that time.
And Karen Martin has another question. We're just waiting for her to put it in the chat. She's asking, are all identified children eligible for early intervention services through the Maryland School for the Deaf?
So after the screening process, when families are referred for the early intervention services, that is actually outside of the scope of the Maryland EHDI program, unfortunately. So we don't have any control over actually enrolling families or anything beyond just the screening and diagnosis piece.
And Lisa is asking, did we have an answer about payment for diagnostic evaluation by 3 months if family has no private or state funding?
Oh, Lauren, I tapped you to help
Yes.
support that answer.
Sorry. And I wasn't sure before, so thank you for clarifying that you were referring to diagnostic evaluation. So I believe, I know maternal care is covered through 6 months postpartum, and I believe for Medicaid. So I believe there are resources. We don't have a direct, and Erin, feel free to chime into the chat because I see you're on as well, if you have a different answer. But I believe that we would be able to identify resources for those that are uninsured. There are some programs through Department of Health. So we, if there are specific cases, you can reach out to us and we can work to identify resources for those families.
And we also have an answer for the Maryland School for the Deaf question from Marnie. All children who are deaf or hard of hearing are eligible for early intervention through the Maryland Infants and Toddlers Program. The IFSP team, well, just lost it, with the family as key members, determine the services, including MSD. And Patricia Muldowney from Maryland School for the Deaf is also chimed in. Any child identified as having a permanent hearing status can receive services from the Maryland School for the Deaf. And her information, along with Amy Lindley, are both in the chat box. Another question, is Maryland EHDI working on the late identified initiative that was recommended about 2 years ago? If yes, can you expand on this additional program?
Lauren, I saw you on. Do you
I know, because you weren't here 2 years ago, and I was pretty new at the time. I'm sorry, Tracy, would you mind expanding on the chat? Are you like referring to late onset hearing loss? I just trying to clarify because this was right around the time I actually started with MDH, so I'm don't specifically recall that. So for those who are at, we send at-risk letters. So for babies who are identified at the birth facility or during their screening as risk factors for later onset hearing loss, we do send letters informing them that they were identified as having a risk factor and that they should continue with follow-up and getting needed hearing screens. And we send out information on hearing milestones to look for. So we do, that is an ongoing project.
You have another question. At what point do new parents receive parent-to-parent support or deaf hard of hearing role model support to encourage early intervention enrollment? Do you think that would help with the large gap in data between referred to EI versus enrollment?
So once a baby has had their diagnostic exam, they will be contacted about support services and early intervention enrollment. So if that is done, at 3 months, that information is then relayed at 3 months. If it's done at 4 months, the information is then relayed at that time. I do think that looking into where and how that information is communicated and providing that information at different stages to parents will definitely help with increasing that enrollment number, the referred versus those who do enroll, to be specific. And thank you to Marnie and team. I'm sorry I didn't catch the name of the other participant who offered the additional information on the early intervention eligibility question. Thank you for that. So I do want to be respectful of time because I know that we do have another presentation today. But to close this out, I do, want to say that the Maryland EHDI program would like to thank the Maryland families and Maryland EHDI program stakeholders for all you do to continue to improve the statewide EHDI system of care. Thank you all.